Welcome back, everybody, to John David's Journey. Today, we're going to be asking the question, what is a CHD and who has it? So first off, a CHD is a congenital heart defect. That is when you are born with a structural problem with the heart or possibly major blood vessels. It happens during fetal development, which is what happened with John David. Now, in his particular situation, he has two critical CHDs along with a VSD, and I'll talk about all those here in a second. If you've watched the Tausig Bing video, then you know that a VSD is a ventricular septal defect, which is a hole in the heart, which allows for the blood to mix. Now, there are a lot of different types of CHDs. The most common are ASDs and VSDs, which are atrial septal defects, and ventricular septal defects, which again are holes in the heart that allow for the blood to mix. Valve defects are also pretty common, which are the valves that open and close, allowing the blood to flow through. Depending on the severity of the ASD, the VSD, or the valve defects, they may or may not require surgery. For example, my grandfather was 70 when they found out that he'd had a CHD his whole life. He had a small VSD. Never caused him any issues, and they only discovered it because they went and put stents in his heart because he was having heart problems from clogged arteries. Some critical CHDs include double outlet right ventricle, hypoplastic left heart syndrome, transposition of the greater arteries, tetralogy of Fallot, and interrupted aortic arch. Two of these, John David has double outlet right ventricle and transposition of the greater arteries. And again, if you've watched his particular diagnosis on the Tausig Bing video, then you know that he has a hypoplastic aortic arch, which means that it's smaller than it's supposed to be, but it's not quite an interrupted aortic arch. An interrupted aortic arch is where it's completely cut off. That's actually what they thought he had for about 8 weeks before we were able to see that blood was actually passing through it. All of the critical CHDs pretty much require surgery early on in life, usually within the first year of being born, and a lot of them require it pretty quickly, just like John David's, where it's very early in life, usually the first couple weeks. Now, there are plenty of people who have CHDs that you may not have known they had CHDs. Plenty of famous people like Shaun White had tetralogy of Fallot, like our buddy Branson. Brian Luttrell, who is the Backstreet Boys singer. Bret Michaels, Arnold Schwarzenegger, which Brian Luttrell had a VSD. Brian Luttrell also had a VSD. Bret Michaels, which is the guitarist from the band Poison, he had a hole in his heart as well, but his was a little different. It was called patent foramen ovale. Arnold Schwarzenegger, former governor and actor, had a bicuspid aortic valve. Teddy Bruschi, who was a linebacker for the New England Patriots and won several Super Bowls, also had a CHD. Same as Bret Michaels with the patent foramen ovale. Ed Helms also has a CHD, although he hasn't disclosed exactly what his is. And then there are people who are related to celebrities who've had this as well. Sophia Stallone, who was Sylvester Stallone's daughter. T.J. Olsen, who is Greg Olsen's son, who used to play for the Panthers as a tight end. And Jimmy Kimmel's son has tetralogy of Fallot, along with pulmonary atresia. Now, there's also been people who are famous who have passed away from this. Kirk Urso, who was a soccer player at UNC and later on in MLS at Columbus Crew. Joe Strummer and John Glasscock, who were both musicians. Joe Strummer for Clash, John Glasscock for Jethro Tull. And then probably the most famous one that y'all will remember, and I know I remember because I used to watch this show when he passed away, Eight Simple Rules for Dating My Teenage Daughter, John Ritter. He had an undiagnosed CHD, which actually led to his cardiac arrest on set and led to his passing. Now, some facts about CHDs. 1 in 10 children with a critical CHD will not live to see their 18th birthday. So 10% of children with a critical CHD don't make it to adulthood. 1 in 100 kids are born with a CHD, which basically equates to about 40,000 babies being born every year in the U.S. with CHDs. And if you're wondering why I did all the celebrities, I'll tie that in here in a second. The lifetime medical costs for an individual with CHD can exceed $1 million. We're on day 35 now, so I could very much believe that. Individuals with congenital heart disease and their families are at a high risk of developing anxiety, depression, and PTSD due to the emotional and physical challenges, along with financial challenges. So yeah, I can definitely see that as well. Something that we hadn't made really public to everybody is that when John David went into cardiac arrest that night, Mallory and I were in the room with him. So there has been a lot of processing because of that. It has been really hard on both of us, and for a lot of it, it has required some processing. This is actually part of my way of processing. It's helped making these videos. But I can completely understand why there would be a lot of people, both with CHD and family members of people with CHD, who would have that statistic. A newborn with CHD will average 3.2 surgeries in their lifetime. Most of them will undergo more. John David's already done more. He's already had 3 major and 4 minor surgical procedures, and he's got at least 1 major one left. And that's if there's no other circumstances that pop up. Most causes of CHD are unknown. Only 15 to 20% actually have like a research reason and they know why it happens. The rest of them, they don't. Like, for example, with John David's, there is no real understanding as to why it happens. Just seems to be kind of like, oh, it happens. CHD is 60 times more common than all childhood cancers combined. And then also, last thing, despite being the leading cause of birth defect-related deaths, CHD receives significantly less research compared to other medical conditions. For example, in 2020, CHD got $40 million from the government, whereas cancer and diabetes received billions. So one of the reasons why I did the celebrities at the beginning and kind of get that out there is that it's not like this is unknown. It's not like it's not common. And in no way am I saying that cancer and diabetes should not get funded. The only thing that I'm saying is that maybe there should be more awareness for the CHDs and that it should be funded better than what it is. Also, something that we have not made really well known, but since we've been here, there have been other babies that we've seen not make it. And that is really tough. And again, going back to the PTSD part, being as close as we were, having him go into cardiac arrest and then go on ECMO life support. And, thankfully he came off, but we have seen other children who have not. And so that is a whole lot. And if it just requires more money to prevent that, I don't see why we wouldn't do that. Again, hopefully nobody ever has to go through any of this, but the reality is that we know that people will, which is one of the reasons why I'm making these videos, is that hopefully somebody else can watch these and use these as a resource for themselves to prepare for their time, and hopefully they don't go through the complications that we've gone through. But I really do hope that the end result of all this is that there is more awareness for CHD and that we can have more funding and research go into it. The doctors here have been phenomenal and have made strides. I'm sure if y'all want to look them up, Dr. Turk and Dr. Overby have been kind of the cutting edge of this stuff, doing partial heart transplants. Here recently they did a domino heart transplant where different pieces of a heart went to, I think it was one particular heart, went to 3 different patients because they used parts out of that one heart to give to 3 different patients. So they are making great strides. But I would love it to see if we got more awareness and more funding for people like them to continue making strides in this field, so that way fewer babies had to pass away. So if y'all have any questions, feel free to throw them in the comments. I'll answer them, and feel free to like and subscribe. Hope y'all have a good day.